Welcome to the OVA vlog. Today we're talking about the Affordable Care Act. Specifically, we're going to look at 5 features of the Affordable Care Act that support women. Republicans are getting closer and closer to repealing the Affordable Care Act. And whether you are for or against the repeal, it's important that you're aware of 5 features that support women and that are worth protecting. The first of these features is that the Affordable Care Act required insurers to include maternity benefits. So maternity benefits are prenatal visits and the cost of delivering a child. And prior to the ACA, only 12% of individual market plans included maternity benefits. However, now with the Affordable Care Act, all insurers have to include these benefits. The second feature is that the Affordable Care Act made it so that insurers could no longer charge women higher premiums just because they were a woman. And this happened across the country. In fact, in Arkansas, if you were a 25-year-old woman, you could pay 81% more for your premium than a man of the same age. And with the Affordable Care Act, insurers are no longer able to do this. The third feature is that the Affordable Care Act provided preventative care services without cost sharing. So you can get your mammograms, your pap smears, your birth control, all without paying copays. The fourth feature is that the Affordable Care Act supports breastfeeding. In fact, insurers have to cover the cost of breast pumps and breastfeeding support. It even went further and requires employers to provide time and space for breast pumping. The fifth feature is that the Affordable Care Act did away with any sort of discriminatory practices because of pre-existing conditions. And prior to the ACA, pregnancy was considered a pre-existing condition. So if you were pregnant and you were looking for health insurance, you could be denied just because you were pregnant. If these are features you want to protect, it's important that you speak up. And you have an opportunity because Senator Gillibrand from New York is putting together an amendment that would protect these women's health features even if the Affordable Care Act is repealed. So speak up, talk to your representatives and let them know that you support Senator Gillibrand's amendment. It's also important that you talk to your friends and family and let them know that these features exist under the Affordable Care Act. It's not okay that whether or not a pregnant woman can get insurance or whether or not we can get access to maternity benefits is up for political debate. Thank you.